Hi, my name is Tori Hadaway and I'm the Specialist Asthma Nurse in Tower Hamlets. These videos aim to improve your knowledge on asthma and allergy. Asthma is the most common long-term medical condition with 1 in 11 children affected, roughly 2 to 3 in every class. The UK has the highest mortality rates for children and young people with asthma. Children living in deprived areas are 22 times likely to have an emergency admission than children living in less deprived areas. I hope you enjoy watching these asthma and allergy videos to increase your awareness and understanding on how to manage your child's condition.
Asthma is common. 3 children in every class have it. Asthma affects your breathing tubes. Imagine your lungs like an upside-down tree. Asthma is a problem in the smaller airways, a bit like the smaller branches on our tree. The inside of the breathing tubes are inflamed. That means red, sore, and swollen. This makes the tubes twitchy, sensitive, and more likely to have an attack. This can get worse with triggers or when we are unwell. There are things we can do to help asthma. Take preventer medicines, usually inhalers. Understand what causes your problems and avoid triggers. Having an asthma plan helps you to know what to do. When we use inhalers, the medicine needs help to get deep into the lungs where it is needed. If your inhaler is shaped like this, the medicine comes out of the inhaler at over 70 miles per hour. It needs to get around the corner and deep into the smaller airways. We use a spacer to slow the medicine down and make sure it gets to the smaller tubes to treat the asthma. Take off the cap, shake the inhaler, put it into the spacer, blow out gently, get a good seal, press the inhaler, breathe slowly and deeply 5 to 10 times in and out. Repeat all the steps if you need another puff. If you're not sure you're using your inhaler right, speak to your asthma team or the pharmacist. Having an asthma plan makes you 3 times less likely to have an attack. Some use a traffic light system to tell you what to do. Green. Even when we are well, we need to take the preventer every day. Amber. Things aren't quite so good. You may need to use your rescue inhaler more. If that isn't working, you may need to get advice from your GP practice or asthma team. Red. If things are no better, you may be having an asthma attack. Follow your plan. You may need to use up to 10 puffs of your rescue inhaler. If that doesn't help, or you need to repeat within 4 hours, it is an emergency. You must get medical help. Call 999. An asthma attack means something needs to change. Your asthma team will know what to do to help. Well-controlled asthma lets you live your normal life, get a good night's sleep, and you won't need to use your rescue inhaler often. Uncontrolled asthma disrupts normal life and can be dangerous. Triggers make your asthma worse. They include things like infections, hay fever and allergies, smoke and pollution, exercise, weather changes, or even feelings. Knowing your triggers help you control them. If you are using your rescue inhaler more than twice a week, coughing or wheezing, sleeping badly, or unable to exercise or play, then you probably need some help. Your asthma plan will tell you what to do. It's important to know what to do in an attack too. You should always have your reliever inhaler with you, just in case.
Thank you for watching this video and I hope that you have increased your knowledge on asthma and allergy management. Make sure your child has an asthma annual review every single year for new spacer, asthma plan and medication review. If your child's not been using their reliever inhaler for long periods of time, then it may be they can be de-escalated on their asthma treatments, such as their preventer inhaler. So make sure that you discuss this when you have your review. Make sure that you supervise regular preventer medication or any other medication with your child, as it's your parental responsibility to make sure your child's having their treatments. Poor asthma control is coughing at night time, frequent attacks, using your blue inhaler or reliever inhaler more than 3 times a week or every 4 hours. You should make sure that you get an urgent asthma review. More information can be found on the YouTube page to make sure that you know how to use your inhalers and how to look after your spacers. If your child is still not controlled, despite a review, you can self-refer yourself by emailing to me, and I'll put that at the front of the YouTube page. Thank you. When we look at allergy, around 5 to 8% of children in the UK are thought to have at least one food allergy. That's 1 in 13 children, roughly about 2 to 3 in every single class.
An allergy is the response of the body's immune system to normally harmless substances. In most people, these substances, also known as allergens, pose no problem. However, in allergic individuals, their immune system can identify an allergen as a threat and produce an inappropriate response. In the UK, 40% of all children have been diagnosed with an allergy. Allergy symptoms can affect all aspects of a child's day-to-day life, including their education, health and well-being, and social activities. The most common allergens are pollen from trees and grass, house dust mites, mold and damp, foods such as peanuts, tree nuts, milk, eggs and shellfish, furry animals such as cats, dogs, horses, rabbits and guinea pigs, stinging or biting insects such as wasps and bees, medicines. When a person comes into contact with an allergen, it triggers a response which causes release of substances and chemicals such as histamines into surrounding tissues. It is the release of these substances that cause the allergic reaction. These substances usually cause local symptoms in a particular part of the body, such as the eyes, nose, or a small patch of skin. Allergic reactions usually happen within a few minutes of exposure to an allergen, but symptoms can take up to 2 hours to present. Anaphylaxis is a potentially life-threatening, severe allergic reaction. It's a medical emergency and requires immediate treatment. The substances released within the body during an anaphylactic reaction are released into the bloodstream and cause a whole body response to the allergen, rather than a localized response seen during a milder allergic reaction. Symptoms of anaphylaxis usually occurs within minutes of exposure to an allergen. However, reactions can also take up to 2 hours. If a child is experiencing anaphylaxis, they must be given adrenaline via intramuscular injection into the thigh. This is called an adrenaline autoinjector, or an AAI for short. Most responses to allergens do not result in an anaphylactic reaction. However, if you are unsure, it is safer to administer the adrenaline and call 999 for assistance. Symptoms of an allergic response can vary from child to child, but the most common symptoms of a mild allergic reaction are rashes or hives visible on the skin, swelling or itching in specific areas of the body such as the skin, eyes, ears or lips, a runny nose or sneezing, an upset stomach, nausea or even vomiting. During an anaphylactic reaction, a child can experience life-threatening problems, which are often described as the ABC symptoms. These include A. Airway, swelling in the throat, tongue, or upper airways, tightening of the throat, a hoarse voice, or difficulty swallowing, excessive drooling or dribbling. B. Breathing, sudden onset of wheezing, persistent coughing, shortness of breath, noisy breathing, or breathing difficulties. C. Circulation, dizziness, feeling faint, sudden sleepiness, confusion, pale or clammy skin, loss of consciousness, and the child may report a sense of something terrible happening. When tragedies occur due to an anaphylactic reaction, it's usually because people have difficulty in differentiating the symptoms from those seen in a milder allergic reaction. That's why it's critical to be able to recognize the difference in the severity of symptoms. Avoiding known allergens is the best defense to prevent allergic reactions from happening. However, accidents can happen. Some people can experience allergic reactions to allergens they have been in contact with before, with no problems. So, it's important to know how to recognize the signs and symptoms of an allergic reaction and understand treatment options. All children with allergies should have an individualized allergy action plan, and schools should ensure that staff members are aware of changes or updates to a child's plan. If a child with allergies does not have an up-to-date allergy action plan or access to an auto-adrenaline injector, AAI, if one has been prescribed for them, they must obtain this from an appropriate healthcare professional immediately. A mild allergic reaction can be relieved by administration of an antihistamine at the first sign of a reaction. A child's prescribed antihistamine will be stated on their allergy action plan. Additional food, outside of meals, should not be given to children with known food allergies, and food provisions should be carefully considered during off-site activities and school trips. Extra care should be taken by school staff, including catering staff and pupils, to reduce the risk of cross-contamination. All allergens should be clearly labelled on food products to help avoid hidden ingredients. Schools should make reasonable adjustments for children with food allergies, for example, providing the option to bring in packed lunches rather than eating school meals. Fostering an inclusive environment at school can help children with allergies feel less anxious and reduce negative connotations surrounding allergies. This can help to promote a safe environment for children to share their concerns about their allergies and feel comfortable in asking for help. Anaphylactic reactions must be treated via intramuscular injection of adrenaline into the thigh, using an adrenaline auto-injector device, which is known as an AAI. Adrenaline works by preventing cells in the body from releasing the substances produced in response to exposure to an allergen and reduces the symptoms of an allergic reaction. If a child is in anaphylaxis, 1. Administer the AAI without delay and follow the child's individual allergy plan. Always bring the AAI to the child. Do not ask the child to go to where it is. Make sure you note down the time the adrenaline was given. 2. Help the child to lie down on their back and raise their legs. This will help to raise their blood pressure and reduce feelings of dizziness. If the child is feeling short of breath, they may benefit from being propped or sat up. Avoid any sudden change in posture, even if the child is feeling better, as this may cause a drop in blood pressure. 3. Call for an ambulance. Tell the ambulance staff this is an emergency case of anaphylaxis. Anaphylaxis. State the school's address, including the postal code. 4. Call the child's parent or guardian. The effects of adrenaline can wear off quickly, and the child may need to be given a second dose. If the child's symptoms have not improved within 5 minutes of administering the first dose, you can give a second dose of adrenaline in the other leg. It's very important that every child who has been prescribed an AAI has 2 AAIs on their person or placed in an easily accessible location. This is in case they require a second dose or the first dose has misfired. To be accredited as an asthma and allergy-friendly school, the school must have an emergency AAI device stored on site for these situations. If a child having an allergic or anaphylactic reaction also has a diagnosis of asthma, they may need to be given their blue salbutamol inhaler via a spacer after they've been given their AAI, as an allergic reaction can often make children with asthma wheezy. There is no need to remove clothing to administer an AAI, but take care to avoid buttons, zips, or thick seams on clothing when administering the AAI. There are 2 types of adrenaline auto-injector, AAI, but they contain the same medication called adrenaline, and they work in the same way to reverse the symptoms of an allergic reaction. If using an EpiPen, hold the EpiPen with the blue cap pointing towards ceiling and the orange tip pointing towards the floor. Blue to the sky, orange to the thigh. Remove the blue safety cap by pulling straight upwards. Place the orange tip at 90 degrees to the child's outer thigh. Push the orange tip firmly into the child's outer thigh at a right angle until you hear a click. Keep the AAI in place and hold firmly for 3 seconds before removing and safely discarding. If using a Jext pen, hold the Jext with the yellow cap pointing towards the ceiling and the black tip pointing towards the floor. Remove the yellow cap by pulling straight upwards. Place the black tip against the child's thigh at 90 degrees or at a right angle to the thigh. Push the black tip firmly into the child's outer thigh until you hear a click. Hold the injector firmly in place for 10 seconds before removing and safely discarding. Massage the injection area. Medication and AAIs should be safely stored with or close to the child, but not locked away in cupboards where it cannot be accessed quickly or easily. All medications should be stored in their original packaging in a cool, dark place at room temperature and kept out of direct sunlight. In secondary schools, some children will be capable to keep their medication on their person, but this needs individual assessment for each child. All medication have expiry dates, and these should be checked regularly. If you notice that medication is out of date or close to expiring, families should be informed to replace personal medication, and emergency generic medication should be replaced by the school as soon as possible. An AAI should contain clear, colourless solution. If the solution is discoloured or contains particles, it should be replaced, even if it's still within its expiry date. AAIs are single-use only and need to be disposed of correctly and replaced straight away. Used AAIs can be given to the ambulance crew or disposed of in a yellow sharps bin if you have one. School staff can only give generic or emergency AAIs in schools for children who have an allergy plan and parental consent. If the school's generic AAI has been used, it needs to be replaced as soon as possible. If you suspect that a child without an allergy plan is experiencing anaphylaxis, then call 999 and seek advice. Make it clear to them that your school has access to an emergency AAI device. A child with allergies will be given an allergy action plan upon diagnosis by a medical professional. The plan does not need to be updated unless there are changes to the allergens or medications. The plan includes symptoms of an allergic reaction and will state the details of the child's prescribed medication for both a mild or moderate and severe reaction. The plan also includes step-by-step instructions of how to administer an AAI. The administration of the AAI will differ depending on which device the child has been prescribed. Parents should bring a copy of their child's allergy plan into school, along with their child's allergy medication, which should be clearly labelled with their name and class. This plan and their medication should be easily and quickly available and accompany the child on school trips.
In summary, anaphylaxis is fatal and an auto-injector pen can save your life. So make sure you always carry two with you and your allergy medication wherever you go, even to the shops, visiting family or friends, going to and from school, or if you go to any appointments. Make sure that you have an allergy plan with you and at school. It will tell you what things that you need to avoid that might cause anaphylaxis, and it also informs others what to do in an allergic reaction. Make sure you know how to use your auto-injector pen and check for the expiry date. You can use a dummy pen to show friends and family how to use, and at the front of the YouTube page I put where you can order them. New allergies, or if you feel that you've grown out of your allergies, then please ask your GP to refer back to the allergy team to reassess their status. Thank you for watching the animation videos today. I hope you enjoyed them and learned lots. Please, if you could feedback on the animations. They were created by one of our asthma nurses, Laura King, and was funded by Bart's charity. So we really would appreciate your feedback. Thank you all. Have a nice day.